Okay, good afternoon, colleagues. I think a great way to begin this slide on care and compassion is to remember that our students are not studying from home, but in actual fact, our students are at home during a lockdown trying to study. I think the COVID-19 pandemic has changed our lives forever. It has taken us out of our comfort zone. And as an initial response, I think it has brought us into a panic and fear zone. Let's listen to one of our students' personal experience of learning during COVID-19.
This has affected me badly since we have loads of work to cover under such circumstances and the time is going. I'm starting to get anxious. This leaves me with thousands of questions. If what's going to happen when we recommence with our studies, are we going to be given tests and some loads of work again on top? And I'm starting to forget everything that I've learned before lockdown in our lecture halls. Again, what's going to happen to our qualifications the same? Is the academic year going to be cancelled? Are we going to repeat S1 again? This is really affecting in such a way that you can start to think otherwise about school, having thoughts of giving up.
As you can hear, colleagues, this student's fears, anxiety, uncertainty, and concerns are not unique or unrealistic. These are thoughts and feelings experienced by most academics and students. This panic has forced us as academics to pause and reflect on our practice. It has given us a much needed time to learn from the situation that surrounds us, while also unlearning some of our traditional ways of teaching, and then to relearn new ways of doing and engaging with our students. The pandemic has certainly given us an opportunity to rethink our teaching and learning in a more caring and compassionate way. We have decided to highlight 5 ways in which you can bring care and compassion into your teaching. Firstly, care for yourself. This is the #1 priority. For you to show care and compassion to your students and colleagues, you need to be physically, emotionally, and spiritually in a healthy space. Keeping in touch during this time of lockdown and social distancing is important for our well-being. We need to communicate with each other, keep in touch with our students and colleagues, especially the most vulnerable, isolated, and needy students. You know, colleagues, we are no Wonder Woman or Superman. We need to be realistic about what we can do and what we cannot do in our modules. We need to keep it simple, clear, and concise. Fourthly, showing kindness and support to colleagues and students is so crucial during this time. They could be going through a difficult time, maybe lost loved ones, lost their jobs, their homes, or even suffering from the illness. We need to show kindness and support during this time. And we should also be willing to give and receive care and compassion. Finally, I think we need to bring the pandemic discussions into our classrooms. It should be infused in our lessons, connecting our students with our realities, and hopefully help to flatten the curve. I now will hand you over to Francois from University of Free State